welcome back to my channel. My name is Khadija Tanishola, and my channel I talk about everything related to women and midwifery. In today's video, I'm going to be talking about pain management in labor. So this video is for you as a midwife. This video is for you as a woman. This video is for you as a pregnant immigrant in the UK. This video is for you as well as a expectant father and all of that. So basically, this video is for everyone. Try to, if it looks like what you are interested in, stick around, watch this video till the end, and don't forget to like, comment, share, and subscribe to my channel, as I'm going to be posting a lot of information regarding this in my channel. And don't forget to click on the notification button as well, so you get notified whenever I post a new video. So regarding pain management options, I'm going to be relating this to our home country. And when I say our home country could be Nigeria, could be Ghana, could be, African country, could be Poland, could be any country, could be India, Bangladesh, anyone you at all. That's your home country, basically. So, pain management options are available and they are numerous while you are in labor. As we all understand and know that labor is something that is painful and it's something that we cannot afford to go through as a woman, especially if you are aiming to have a vaginal delivery. So labor pain, if you're actually in labor, in established labor or something, is going to be painful. And as time goes on, the more painful it is, like the more closer to you are to having your baby, kind of. That's just how it looks like, basically. So there are options available for you in the UK that might not be available in your home country. And because these options are not available in your own country, you at times some people think, no, I'm not. If I have this, if they give me these medications, my pain is going to stop. My pain is going to this and that. I want you to understand that these pain, medications or options, they are not meant to like totally take away the pain. They are just meant to relieve the pain. Until you have your baby, you might not totally get half of pain, basically. So you know these options are just available for you to temporarily relieve you of the pain. So if you have pain relief in labor, that doesn't mean your labor, is going to get, kind of, your pain is going to stop. They are not meant to stop the contractions pain. The contractions pains will still be there, but you might not feel them as much as you were feeling them before. They work in such a way as to reduce the sensations, or the kind of transmitters that transmit the pain, the sensation from the nerve endings to your brain that make you to express that pain. They are meant to interrupt those activities and would not make you to really feel the pain. But I want you to understand that the contractions are still there. Basically, the pain medications, pain reliefs are not taking your labor pain totally. They are not taking them away totally, and they are not stopping your contractions. So when next you go into labor, try as much as possible to really erase the notions that pain medication stop your labor process, and because of that you're not going to get any pain medications and you're just going to be in pain. I understand these are choices you need to make for yourself. If you made up your mind that this is labor, you want to have everything naturally, you don't want to have pain medication, yeah, that's fine. If you can, that's fine. That's absolutely fine. It's an options you can have as well. But if at any point you think you're not coping again, it's something you can change. It's you, it's yourself. You can always change your mind. And you can always let the midwife know whenever you change your mind. They're not going to hold it for it. They're not going to hold you for, changing your mind or not changing your decisions. Nobody is going to like hold you for whatever decisions you make for yourself. So having said that, I'm going to be listing the pain, relief options you have. As you all know, most of us think paracetamol is doing nothing. Basically, pain pain relief pain management options in labor start from the least things you will ever think of. Basically, it start from even just talking, even psychological care that you have from your partner, physical touch, all of that. There are things you can use to manage your pain in labor. Some of you can also use diversional therapy, like watching movies, your best TV series that you like going on, or your K dramas, everything. You can use that as a diversional therapy. You can also have music, soft music, if that's what you want, playing beside you. For the Muslims, you can also have your best reciters beside you, playing beside you. That's also like part of the diversional therapies you can have in labor. You can have your partner with you throughout the process of labor, and I wish the back home they could allow all our partners to be with us while they could allow our partners to be with us in labor room as well. I understand that a lot of factor influences the influences this decision back home, especially, and one of the main hindrance to this is space, availability of space. So sometimes where people are laboring in an open environment, we could have like 4 5 women there, and each of them have partners, and some of them are open, they are not, some of us, when we are in labor, we already, we don't even care what we are putting on and all of that. So because of this, we wouldn't want different partners to be in the open space with you looking at other women and all of that. That's one of the factors that influences, whether you're having your partner with you or not back home. But right here in this place, you can have your partner with you in delivery, in the laboring room or in the delivery room, because most of the time it's actually a room to yourself. It is a room to yourself, so it's always easy for you to have your partners with you in the delivery room, to give you those psychological support that you could have. Another thing is that before you actually fall into labor, you can think about the kind of things you want to do in delivery, in labor. I want you to understand this, that it is painful, absolutely, but you can design how you want to go through the pain, how you want to experience it, and all of that. And you need to understand that everyone's are different, because your friend narrates the process to you to be kind of an horrible situation doesn't mean you're going to feel the same. So you should try as much as possible, create your own way of reacting to labor pain, kind of. That will also help you. Then, having said all of this non-pharmacological method of pain management in labor, going to pharmacological method, that's the medications that the midwives can give you. Before going to the medications, I can also talk about the support you can get from your midwife. Your midwife is there to give you all the support that you need during the birthing process. Try as much as possible to utilize it. If you have any questions at all, or you wish the midwife could do something differently for you, try as much as possible to say it. The midwives are listening person. They are passionate individual that specialize in taking care of you while you are in the what I can call like experience. I think the experience is actually personal, but at the end of the day, the experience shape your life, forever. The experience you have in labor shape your life, shape the way you see things outside the delivery room, shape the way you take care of the child, the way you relate to other people. It affects your life forever, so your entire life. So you need to really, the midwife are really there, they understand this, and they are there to provide the support that you need for you. So please utilize them, especially if you find yourself in this country. So the midwives are really, really doing great. You should try as much as possible to make use of them in your pain options as well, management options. So when we talk about the pain medication actually starts from paracetamol. I'm sure most of you will be like, "How paracetamol? What's paracetamol is going to do for me? Paracetamol doesn't. It's just for my headache. It's just when I'm when I'm this, when I'm that. It's part of it. It could help you as well." Another thing that we can, and that paracetamol is under the sorry, is under the NSAIDs group of pain medication. So you have that. You can also have the opioids as well, which is the like the strong analgesia that they could do have effects. They have a kind of depressive effect, kind of. So you could have that as well. And don't forget that those options are actually used with caution, and there are really really lots of them, but you can't have two of them at the same time. So if they are giving, for instance, they have codeine, you can have codeine, morphine, there are codeine, there's morphine, there are morphine, there are, petidine, there are all of those names. So um each hospitals have the one that they basically use, but all of them are actually in the same group. For instance, in my space, we do use the codeine as the oral codeine, and we use petidine as well. In some other places, they may be using morphine, they may be using diamorphine. They may not be using petidine, they may be using another type of opioid analgesia. But you just need to understand that there are opioid options for you, and because of the depressive, of its depressive actions in on the respiratory system. So they are most of the time using with cautions. So most of the time before they give you, they want to monitor that. They want to make sure that the baby is fine. They want to do a CTG monitoring on the baby. They want to really assess you vaginally to be sure baby is not close by, so as to prevent the baby it from you know affecting the baby when baby come out, because if it depresses your own respiratory system, it can depress the baby respiratory system as well. If baby is going to be coming in an hour, it is not advisable that we give you, but if you insist, we're going to tell you the implications of having it, so you can still have it as your choice. Not like total no, but we're going to tell you the risk that is associated with it. Another options you can have the gas is the gas and nail, the gas and hair basically in Zentonos. Back home, back home, these are things we just read in book in my country basically. I know there are some country that are more developed than mine. I know there are some country that could have it as well, but unfortunately, in my dear country, we don't really have it generally for everyone, except in some private hospital, which may have it. I was not opportune to work in those hospitals anyway, so we may have some private hospitals that have it as an option as well right now. So this is another thing that you can use. It is gas, and it is just there. It is just made up of oxygen and air basically that is inside. You pop it in your in and like hair, and it's going to help. So that as well have, there are stages you use it based of the time, because of the way the words are built as well. There are places they do offer it, and there are places they might not be able to offer it for you. But obviously when you are in labor, it is being offered to you if you want. Then another thing, the main thing is another thing you can have is epidural. I know some people have a pleasant experience about epidural, and some people have otherwise. So it depends on whatever way you have experience you have with epidural. But epidural could be effective as well, but and everything actually have its own side effects basically. So when before you be given the epidural, the anesthetic is going to talk to you about everything regarding the epidural, the side effects, the benefits, the rate of the complication, the percentage, and everything you should expect in epidural. So basically, unlike back home, that your ability to bear pain determine your braveness as a woman or something. That doesn't work. You're not getting paid for doing that. So if the pain is getting some more, it's becoming something that you cannot bear, please request for pain medications, pain relief, and understand that these pain reliefs are not meant to totally take away the pain. You might not totally be pain free until you have your baby. And of course, if you want to go for the sharp place way, you want to go for cesarean sections as well. After the sections, you still have pain options as well. So postpartumly, pain management option postpartumly, post cesarean section as well. You have pain most of the time, especially from the operation site, from the wound site. So, and of course, it's going to be painful. It's just like, cracking your leg on the nails or something. You know how that feels. Not to talk about getting caught. So you're going to feel some pain after cesarean section. So you have some pain medications that you can always also request for, just as before. You can have analgesia, NSAIDs, and you can also have opioid. And don't forget that we don't use like two opioids together. So the options that they have maybe is there, and because some of these medications may pass through the breast milk to the baby if you choose to breastfeed your baby. So they by some options you have might be limited, but they're still going to tell you you're still entitled to have pain medications if you want. You're not going to get paid for being the bravest person to tolerate pain and all of that. Another thing you can do postnatally to manage your pain is to do some exercise, breathing, minimal exercise, breathing exercise, also support from your partner. And another thing is looking at the baby. You'll be like, oh, looking at the baby, oh, this is the reason I'm doing all of this. This is the reason I've done all of this, all of this, all of this. And that can help you relieve the pain as well. And don't forget to talk to mom that have passed through the stages before, to push you through, to tell you the experience. And also don't forget to only pick the interesting parts of the experience. Create your own experience in labor and try as much as possible to create a positive mindset about labor before you even go into labor. So everything will But if you have this negative mindset in your brain, even if the midwife are trying to be the best for you, you might not really be able to erase that, you know, uh what's it called? That negativity is, or that thought you have in your head. I wish you all the best and I wish you safe delivery. Don't forget to like, comment, share, and subscribe to my channel. If this video benefits you, please share to your friends and colleagues, especially to your pregnant colleagues. Share to them, let them know that they can request for pain medications. I understand that these are not really readily available in Nigeria. When I was home, we don't even offer to give paracetamol in labor. That was so cruel, kind of. So you can share these videos with people and let pregnant women in labor request for paracetamol if they want, and they are supposed to be given back home. Let's not really goes on this cultural perspective that the pain is going to stop the labor, it's going to increase the length of times you go through labor and all of that. That does not happen. The pain relief medication does not totally take away the pain, and it does not stop your contractions. If you do not get anything from this video, please get it that pain relief in labor does not totally stop your contractions and does not stop your labor. They are not given to stop your labor or to stop your contractions. Your contractions will still be there, but you might not be feeling them. And don't forget that the pain relief as well does not totally take away the pain. You can take the medications and you still be feeling pain. Don't forget to like, comment, share, and subscribe to my channel. I'll see you in my